Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal RX.
If you have carpal tunnel syndrome, then you already know what the symptoms are: tingling, numbness, and pain in your hand, making it difficult to work. And if you're like 60 million Americans who are obese, then your chances of having carpal tunnel syndrome are much greater. In fact, they're 5 times greater than the general population. Medical report after report are published all the time, and they cite this relationship in great detail. But we have to ask ourselves, what is it about obesity that causes carpal tunnel syndrome? Why should being overweight cause problems in our hands? To understand this, we have to understand what carpal tunnel syndrome really is. Deep within the wrist, in a space known as the carpal tunnel, the flexor tendons, here shown in white, lie very close to the median nerve, shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. At times, these tendons swell, and when they swell, they push on the median nerve. With obesity, excess tissue puts added pressure on the carpal tunnel, thereby exacerbating the problem. Therefore, the likelihood of having symptoms of carpal tunnel syndrome are greatly increased with obesity. So if you have carpal tunnel syndrome, what can be done to alleviate the pain and other symptoms you're experiencing? Surgery is not the answer, but deep tissue massage of the wrist and forearm is something virtually everyone benefits greatly from. This technique works so well because it drains excess fluid, breaks up adhesions, and enlarges the carpal tunnel, thereby reducing the swelling and inflammation around the tendons. While deep tissue massage is nearly 100% effective in relieving carpal tunnel syndrome, it has to be used every day for 2 to 4 weeks. A professional therapist performs deep tissue massage in a specific pattern over the wrist and forearm. This is the only real way to attack carpal tunnel syndrome. Discuss this therapy with your doctor, and also discuss the fact that most people who have surgery are dissatisfied with their results, but the vast majority of people who have non-surgical therapy are quite satisfied. Your doctor should candidly and openly inform you of this, and discuss options like deep tissue massage of the wrist and forearm. To get professional and effective deep tissue massage therapy for your carpal tunnel syndrome, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have carpal tunnel syndrome, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.